Welcome to Session 3 of our Anxiety Management course. In Session 2, we looked at how anxiety affects our body and the physical symptoms of anxiety that we may experience as a result of the fight or flight response. We also discussed some effective ways to manage the physical symptoms of anxiety, primarily through controlled breathing and progressive muscle relaxation. Have you been practicing these techniques over the past week? If so, reflect on how useful they have been for you. You may find these techniques difficult at first, but it is important to persevere when learning new skills. It may take continued practice before you notice benefits from these strategies. This session concentrates on the role of unhelpful thoughts in keeping the vicious circle of anxiety going. In other words, how our unhelpful thoughts can negatively influence our emotions, physical symptoms and behaviours. In the second part of this session, we will look at ways to identify and challenge anxious and unhelpful thoughts so that we can weaken the vicious circle of anxiety even further. Let's go back to our vicious circle of anxiety. Hopefully you have already started to weaken this circle by using some of the strategies that we have discussed so far in the course. As you can see highlighted here in red, unhelpful thoughts will be our focus for this session. So how do our thoughts feed anxiety? Let's look at an example to illustrate. Here is Paul's vicious circle. Paul has to deliver a presentation at work in a few days' time. As the presentation is approaching, he begins to think about it more and more often. He thinks to himself, I'll be awful, I'll say the wrong thing, I'll make a fool of myself. Everyone will lose respect for me and talk about me. Notice that these thoughts are all very negative and quite extreme. How do you think Paul is feeling if these are the sorts of thoughts he is having? Well, as we can see, he is feeling anxious and worried, and he is dreading the presentation. And because Paul perceives the presentation as something to fear, his fight or flight response has been triggered. This means that he is experiencing lots of distressing physical symptoms, including nausea and headache, and he's also having trouble sleeping. As a result of the way Paul is thinking and feeling about the presentation, he starts to become irritable with others and is generally out of sorts. He has also begun to drink excessive amounts of alcohol as a way of helping him to cope with the way he is feeling, and he is avoiding his preparation work for the presentation. So from Paul's example, we can see that the thoughts he is having about the presentation have triggered his fight or flight response and have negatively impacted on his emotions and behaviours. It's important to note here that if Paul continues to drink heavily and avoid his preparation work for the presentation, then it is likely that it will not go as well as he would have hoped, and that in fact he may very well be awful, say the wrong thing, etc. This is what we call a self-fulfilling prophecy. In other words, what Paul has predicted will happen at the presentation may very well happen as a result of the way he is responding and reacting to the situation. This example demonstrates that our thoughts or the way we perceive situations can determine how we feel, anxious, and how we behave, but that our behaviours can also then feed back into how we feel and the thoughts that we have. This is what keeps the vicious circle going strong. When we are anxious, we tend to view ourselves, situations and other people in very negative ways. Have you noticed this yourself? You may wish to refer back to your anxiety diary from week 1 at this point. What kind of thoughts did you record? What things were you saying to yourself when you were in anxiety-provoking or stressful situations? Were they generally helpful or unhelpful? Let's do a quick test of unhelpful thinking. Do you worry about things by going over them again and again in your mind? Do you dwell on the negative, criticise yourself all the time, expect the very worst to happen and jump to the very worst conclusion about everything? Do you focus on what other people think of you? If you answered yes to most or all of these questions, and you find that you are thinking in these ways regularly, then it is likely that your thoughts are feeding anxiety. As we've seen earlier from Paul's example, our thoughts or the way we think about things can play a major role in increasing our anxiety levels. However, our thoughts or the way we think about things can also play a major role in decreasing our anxiety levels, and that is what we want to work on. If we are currently thinking in ways that trigger and perpetuate anxiety, then it follows that we can learn to think in different ways so as to reduce anxiety. Let's have a look at some of the typical thoughts that people have when they feel anxious. What if type thoughts. So, what if I lose my job? What if I never get a job? What if I can't pay the bills next month? What if I never feel any better? These are what we call hypothetical thoughts, assuming the worst about situations in the future that might never actually happen. These types of negative thoughts feed worry, and you guessed it, more worry, resulting in high levels of anxiety. I can't cope. Due to the nature of the symptoms we experience when we are anxious, we may begin to avoid more and more and put things off as a way of coping. As a result, we can gradually begin to feel as though we are losing control over our lives and lose confidence in our ability to deal with situations that perhaps others would not necessarily consider to be problematic. We may then tell ourselves that we can't cope, which in turn makes us avoid even more and keeps the vicious circle going. Things never go right for me. When we are anxious, we tend to focus on the negative events in our lives and dwell on these. We may believe that bad things always happen to us and that things just never turn out the way we would like them to. We may then be forever on the lookout for the next negative event, which can naturally lead us to feel anxious. I'm useless. When we feel anxious, we tend to be our own worst critic. We may feel that we are struggling with day-to-day life and everyday tasks, perhaps relying heavily on others for support. We may blame ourselves for feeling the way we do and attach a range of negative labels to ourselves, useless being just one of these labels. They all think I'm stupid. How many times have you assumed you know what someone else thinks of you? We tend to do this quite a lot when we are feeling bad about ourselves. We tend to assume that others view us in a negative way, but we don't actually know this for sure. The only way we would know this to be 100% true would be if the person actually told us. I'll be fine if I just get out of here. As mentioned previously, when we are anxious in particular situations, we tend to experience a range of uncomfortable physical symptoms. This often leads us to try to escape from situations, as we think that escaping will alleviate our distress. Over time, we may begin to think that the only way to cope is to escape from situations that make us feel anxious. This is what often leads to avoidance behaviours. When we avoid or try to escape from situations, however, we merely reinforce to ourselves that we can't cope and never give ourselves a chance to prove that actually we can. Let's look in more detail at some of the features of unhelpful thoughts. Unhelpful thoughts tend to be automatic and come out of nowhere. Most of the time, we are unaware of the thoughts that we are having in any given situation, and what we tend to be more in tune with is our emotional response to situations. So we remember feeling anxious, we remember feeling upset, we remember feeling nervous. What we don't tend to remember is what was going through our mind at that particular time to trigger these negative emotions. Negative thoughts often seem very reasonable, and we often accept them to be 100% true without question. However, this can be problematic because most of the thoughts that we have when we're feeling anxious tend not to be true, but rather are just assumptions or opinions based on how we feel at that particular time. If we act or behave according to assumptions or opinions, then our behaviour can become unhelpful too. And don't forget that unhelpful thoughts are the type of thoughts that would make most of us feel anxious. To help us to identify unhelpful thoughts, it can be useful to point out different types of thoughts. So unhelpful thoughts can be what you say to yourself. For example, I will collapse if I have to wait in a big queue at the shop. Images in your head, for example, seeing yourself lying on the shop floor. Or they can also be memories, for example, remembering an image of someone who had collapsed in a shop. As mentioned previously, unhelpful thoughts can be very difficult to identify. However, if we notice a change in how we feel, for example, becoming more anxious, then it is likely that our emotional change has been triggered by unhelpful thoughts. If we don't tackle unhelpful thoughts, they will continue to make us feel anxious and bad about ourselves, and they can gradually become worse and more extreme. Before we tackle unhelpful thoughts, the first thing we have to do is to spot them, as not all of our thoughts will be unhelpful. Most unhelpful thoughts fall into certain categories, or what we call unhelpful thinking patterns. Having a better understanding of what these common patterns are can help us to understand and recognise when our thoughts may be unrealistic and unhelpful. Let's take a look at these just now. So, the mental filter is one of the common patterns that our thoughts may fall into when we feel anxious. This refers to the thoughts that we have when we focus on only one part of a situation, usually the negative, and ignore the rest. For example, thinking about the one person at work who you don't get on with and worrying about it, and ignoring the fact that you get on great with everyone else. Jumping to conclusions is something that you may recognise. This is when we make predictions about what's going to happen in the future, again usually negative in nature, or assume that we know what someone else is thinking. For example, if we are late to meet a friend, we may jump to the conclusion that they think badly of us, or that they will end the friendship. We don't know if that's what our friend thinks, it's just an assumption. Jumping to the worst conclusion can clearly fuel anxiety. Labelling is something we touched on earlier on in the session. This refers to the thoughts that are perhaps very self-critical or self-deprecating. For example, saying to yourself, "I'm just a waste of space," or "I'm useless." Catastrophising refers to the thoughts that we have when we blow things out of proportion. If you catastrophise a lot, you may find yourself saying things like, "That was a complete disaster," or "This will be absolutely terrible." Extreme statements or rules refer to thoughts that usually include the words should or must. For example, "I must be good at everything that I do," or "I should try to please everyone all of the time." Thoughts within this category tend to be related to unrealistic standards that we set for ourselves. When we set ourselves unrealistic standards, then we are continually striving towards something that is unattainable, and that can feed anxiety. We are also immediately setting ourselves up to fail, which can make us feel bad about ourselves. Personalisation is blaming ourselves for things that have little or nothing to do with us, or taking responsibility for things that are out with our control. For example, blaming yourself for the behaviour of your adult son or daughter. Black and white thinking is when we see things as either good or bad and nothing in between. For example, if you think that anything less than perfect is not good enough, then you may be thinking in extreme ways. And overgeneralising is when we assume that based on one bad experience in the past or present, that all current or future situations will follow suit. For example, if you've had a previous bad experience in relationships, you may worry that you will never find happiness in a relationship. Or if you worry that because you weren't successful at a job interview, you will never get a job. To help us to identify if we are thinking in these ways, it can be useful to record our thoughts in a thought diary. Writing our thoughts down in a diary allows us to become more aware of the unhelpful thoughts that we are experiencing in different situations. You are learning a new skill here, so going back to basics and writing things down can help. Let's look at an example. This is Rachel's thought diary. Rachel has recorded a situation when she was at a party and felt extremely anxious and panicky. When she examined her thoughts, Rachel realised that she was telling herself that she looked a mess, that she didn't have anything interesting to say, that people will think she's boring, and that she'll never be invited to a party again. Rachel's thoughts in this situation fall into some of the unhelpful thinking patterns that we have just looked at, namely labelling herself as a mess, jumping to conclusions by assuming that people will think she is boring and that she will never be invited to another party, and generally focusing on the negatives. Could anyone relax and enjoy themselves if this was the thoughts that they were having? The short answer to this is absolutely not. Think about a recent time when you felt anxious. Using the worksheet entitled 3-column thought diary, try to record what you were thinking, what was going through your mind, and what the unhelpful thinking styles were. You may find it uncomfortable, difficult, or even upsetting to come face to face with your thoughts by writing them down. Often we spend much of our time trying to shut unhelpful thoughts out of our mind because we find them upsetting or even embarrassing. Many people find this, so do not worry. Try to just be as honest with yourself as possible about the thoughts you're having so that you can take steps to deal with them. Let's now turn our attention to tackling the unhelpful thoughts that feed anxiety. Logic would tell us that in order to stop unhelpful thoughts, we should try to not think about them, put them out of our mind, think about something else. Let's test this out. Try not to think about a skating penguin for the next few moments. How did you find this? Easy? Difficult? You probably managed to put the skating penguin to the back of your mind for a while, but found that it came to the fore every so often. This is exactly what happens when we try to ignore unhelpful thoughts. They just keep coming back. We need to find more effective, practical ways of dealing with our unhelpful thoughts, rather than just trying to shut them out. What we want to do is to come up with a new way of looking at things. Take a look at this picture. What do you see? There are two faces here, an older lady's face and a younger lady's face. You may only see one of the faces at first, and only after some time see the other. The purpose of this exercise is to point out that there is usually always another way of looking at something, but sometimes when we are feeling anxious, we just can't see it. When we are anxious, we tend to see only the negative perspective. Changing the way we think about things, therefore, and trying to see different perspectives can help us to feel less anxious. When we are anxious, we look for and find threats that keep us feeling anxious. We zoom in on the threats, we find evidence for our fears, and we ignore evidence against our fears. We tend to see only part of a situation, the negative part, and ignore the rest. To help us to see the bigger picture and look for alternative perspectives, it can be useful to think about what evidence there is to suggest that your thoughts are true, and also the evidence that would suggest that your thoughts may not be true. In other words, separating what is factual and what is just opinion or assumption. The aim is that we consider all relevant facts in a particular situation and try to see it in a more balanced, realistic way rather than thinking in extreme ways. Let's go back to Rachel's thought diary to illustrate. When Rachel begins to challenge her thoughts, she realises that many of them are probably quite extreme and based more on her perception and opinion rather than any actual facts. When she looked at the evidence to back up her thoughts, she concentrated on a comment that her ex-partner had made to her previously, and also that someone looked over at her and laughed. Firstly, Rachel's ex-partner's opinion on her appearance is an opinion like any other. It doesn't make it true or factual. And she does not know for sure that the person laughing was actually laughing at her. In fact, it is probably unlikely that this was the case. However, because Rachel is hypervigilant and on the lookout for threats, she has focused on this and jumped to the worst conclusion. When Rachel looks for evidence to contradict her thoughts, she concedes that she is unhappy with her weight, but that her weight does not make her look a mess. She was also able to see that her ex-partner was just quite a nasty person and was critical of most people, not just her. She was also able to remember that far from being boring, her friends always say to her that she is great company. Indeed, why would they have invited Rachel to the party if they didn't want her to be there? When Rachel evaluated all the evidence and looked at the bigger picture, she was able to see a more balanced, realistic perspective on the situation and felt much better and less anxious for doing so. Think back to the unhelpful thoughts you wrote down earlier. Using the worksheet entitled 7-column thought diary, try to challenge these thoughts by looking at the evidence which supports the thoughts and the evidence which contradicts the thoughts, and try to come to a more balanced, realistic perspective. There are some other ways to help you to deal with unhelpful thoughts. For example, it can be useful to think about what a friend or loved one would say to you about thoughts that you're having. Or, what would you say to a friend who was having similar thoughts? What advice would you give them? Can you apply this advice to yourself? Try to gain some perspective on your thoughts or worries. This can also help. Ask yourself, will it matter so much in 6 months' time? Will you even remember what the problem was? And if it won't matter in 6 months, it probably isn't that important now. It may also help to think about how others would deal with problems. Think about someone who seems to handle problems really well and work out what they'd do and how they'd cope in this situation. More questions to help you challenge your thoughts can be found on the worksheet entitled Handout 1. The goal is that you will become an expert in identifying and challenging your own unhelpful thoughts. But remember, it is a new skill and will not happen overnight. It will take time and practice. In time, you may find that you no longer need to record your thoughts in a diary and that you can learn to do the skill in your head. If you're having difficulty with challenging thoughts, then mindfulness is an alternative way of disengaging from or letting go of negative thoughts. Mindfulness is different to a CBT approach in that you're not purposely trying to identify unhelpful thoughts or challenge them, but rather just taking notice of when you're automatically drifting into negative thinking and then redirecting your attention back to the present, the here and now. Mindfulness involves paying attention on the present moment and taking notice of your thoughts, feelings and bodily sensations, and becoming aware of the sounds, smells and noises around you. If you think that this approach would be helpful to you and you would like to know more about it, then visit www.nhs.uk. Mindfulness courses are also available through an organisation called LifeLink. LifeLink's website can be found at www.lifelink.org.uk, or you may wish to give them a call on 0141 552 4434. Over the next week, you may wish to use the thought diary to record and challenge any unhelpful thoughts that you have. Try to come to a more balanced, realistic perspective. Remember that you may find this difficult at first, but try to be patient and persevere. You are learning a new skill, so again, keeping your expectations reasonable. We have now reached the end of session 3. We hope you found this session helpful. In the next session of the course, we will turn our attention to the unhelpful behaviours that we can sometimes develop to enable us to cope with anxiety.